Hi, I'm Alfredo. We are at Desert Regional Medical Center in downtown Palm Springs. Today we're going to go inside and take a look at the trauma center and find out about some of the great opportunities that this hospital has to offer. Let's go inside and check it out. We are here at the Trauma Center with Diana Singh. It's very nice to meet you.
Nice to meet you.
And what is your title here at the hospital?
I'm an administrative clinical manager.
Tell me about your education. How did you get started?
I went to college at the Desert. I've been employed here, like I said, for the last 17 years. I started here as a unit secretary. Went back to school and got my CNA, and then went back to school and got my LVN.
I understand that you just received your master's degree. Congratulations. Did the hospital here help you with your education at all? I understand that they have an amazing, education program here.
Yes, they have wonderful tuition reimbursement, which I utilized every bit of.
What do you look for when wanting to hire somebody new to work here with you in the trauma center?
I would say that we're looking for somebody who's looking for a challenge, someone who's devoted to her patients, someone who has the eagerness and willingness to learn.
Your trauma center is the only one within an 80-mile radius, is that correct?
That's correct.
So you guys must be very busy here.
Yes, we are. We see about 65,000 patients a year, anywhere from 180 to 200 patients a day.
In your time here at the hospital, what would you say has been the most tragic event here in trauma?
For me, I would have to say it was the night that I received 6 gunshot victims all at once, or within about a 4-minute time.
And one of the things I've noticed in talking with everybody throughout the day here at the hospital that I found really interesting was that you have a very low turnover rate here. I believe right now it's something about 8%. What do you attribute such an amazing drop in turnover here?
I think that it's the family environment that we have here. I think we're all a team. I think that we're all going in the same direction. I believe that it's administration taking care of the nurses that helps the nurses take care of the patient.
Well, Dan, it's been great talking to you. I just want to thank you so much for taking your time with us today.
Okay, nice meeting you.
I guess you got to get back to work. Probably lots of people need your help, so.
Thank you.
We are here at Desert Regional Medical Center with Rick Terracina. Hi, Rick.
Hello.
Now, I understand that you're the director here of the Neonatal Intensive Care Unit and Pediatrics.
Yes, I am.
And how did you come about that job? I heard that you started here as a nurse and worked your way up to where you are now. Tell us a little bit about that.
I started here about 17 years ago. I started here as a staff nurse. I got into a management or leadership role here, and then the hospital afforded me an opportunity to go back to school as a neonatal nurse practitioner, which the hospital actually sponsored me, and so I was able to work with my own physicians and my own staff to get my education as well as my clinical experiences as a nurse practitioner. I was offered the directorship program, and this is where I stand right now.
Seems like there's a lot of educational opportunities here at the hospital.
We do have a new grad program where the nurses are hired as new grads, and the hospital is not afraid to hire new grads. There are a lot of opportunities for male nurses as well as female nurses.
Right.
But I just think the Valley itself has a lot of opportunities, a lot of attractions for male nurses also.
Well, Rick, I just want to really thank you for talking with us today. It's been great.
Thank you. Thank you very much. Thank you.
We're now here with Tony Bonero here at Desert Regional Medical Center. It's very nice to meet you, Tony.
Good meeting you.
Thank you. I realize that you're surgical clinical educator. Did I say that correctly?
Correct.
Tell me a little bit about that. What does your job entail here at the hospital?
Well, as we get new employees in to the operating room, whether they're new graduates coming in, we have a strong new graduate program, or whether they're nurses with experience who have worked elsewhere. With the new students, what they learn in nursing school doesn't really apply in the operating room. So we start a whole 6 to 9 month training program for them to acclimate them to the role of the perioperative nurse.
I hear that they have an excellent relocation program.
The hospital offers, especially for certain specialties in nursing, both a relocation bonus, which is very comfortable to meet your moving expenses, and also a sign-on bonus to attract qualified professionals to the hospital.
Tony, I want to thank you for talking with us today. It's been a pleasure. Thank you so much.
Thank you very much for coming out.
You're welcome. I'm Alfredo for Desert Cities Report.